name is Adam Beza.
And I'm Eve.
And you're watching Therapy with Adam and Eve.
Today we're speaking to Jade Thomas, who is a counselling psychologist in doctoral training, who is also working with Eve and I at Private Therapy Clinic. Jade has really kindly offered to just have a quick interview with us about her counselling psychology doctorate, and so we're really happy to have you with us, Jade. Thank you for joining us.
Thank you for having me, guys.
No problem. So is it okay if we can just start off by you telling us a little bit about what the counselling psychology doctorate is exactly? I know that most people kind of hear about the clinical doctorate and less so about the counselling, so it'd be interesting to just know what it is and what made you choose to pick it.
Of course. So the Counselling Psychology Doctorate is the same length of time as a clinical doctorate. So it's 3 years full time, or if you did do it part time, it would be 6 years. And it leads to HCPC accreditation as a fully qualified psychologist. The difference really lies with that the clinical doctorate is funded, so you would get a salary while you're training, whereas the Counselling Psychology Doctorate isn't funded. So you do have to pay for the course. You can either get a postgraduate loan to do that, and you don't, unless your placement will pay you and will offer to pay you to do your placement. Usually you don't get paid for your placement. So that's where the main difference lies. And then there's also the difference in the approaches. So counselling psychology focuses more on a humanistic approach and more on person or client centered, whereas clinical psychology focuses more on the medical model. And I think sometimes the clinical doctorate has more of a neuropsych element to it, whereas counselling doesn't. It focuses more on the psychotherapies in terms of psychodynamic, CBT, and person-centered.
Thank you, Jade. I know it can be so confusing when you're first starting to consider, what doctorate you might go for, and then you just see all these different names of different ones, and you have no idea what they actually mean. So I think that's really helpful kind of summary of what you're studying at the moment. I was wondering if you could tell us a bit more about kind of the general application process, what kind of experience you had before applying, that kind of thing.
Yeah, of course. So my application process was a little bit random, a little bit different, because I decided to apply to do the doctorate quite late. So I'd actually missed a few of the interviews for different universities. So that did narrow down my options of where I could apply. But the application process involves a interview. Sometimes they get you to do a written task. And then that's pretty much it in terms of the interview process. The application process was fairly straightforward, filling out an application form. I know for the university that I'm at, which is Roehampton University, I did have to submit some form of previous work that I'd done. So they asked for a copy of a previous dissertation or just a piece of written work, which was different to the other applications. So the applications do vary of what they look for and what they ask for, but they all ask for maybe a CV, some references, personal experiences, things like that. So they're all pretty much very similar, and then you have an interview as well. In terms of my experience that I had, so I'd previously worked in a school before I worked at Private Therapy Clinic as an assistant psychologist. My first lot of experience in a school was supporting special education needs children, and I was able to do face-to-face interventions with them and also some one-to-one work with them as well, which really gave me a good starting point in terms of face-to-face experience with clients, I guess. Although they were children, they could still be counted to be client work. And then I got offered the assistant psychology internship at Private Therapy Clinic, and I worked there for a year as an assistant psychologist / psychological wellbeing practitioner. And I'd started to see clients. I'd seen clients, I think, for about 6 months before I applied to the doctorate, and initially I thought that might not be enough. So that was what delayed my decision in applying. But then I just thought I'll go for it. And yeah, I got accepted at the University of Roehampton.
That's really great. Yeah, I think especially it kind of shows how much of a good candidate you are kind of to apply on such short notice and get through. And yeah, all of your experience sounds great, especially working with children and stuff like that. So is it okay if you just tell us a little bit now about the actual doctorate? So if we go through just the structure of it, because I know, like we've heard from Laura, we spoke to her previously about the structure of the clinical one. So if you could just give us an idea about how it changes year from year and what sorts of things you're taught. I know you briefly touched upon types of modalities that you're more taught there. So yeah, just a little idea about that would be helpful.
Yeah, sure. From conversations I've had with Laura, the differences between our doctorates are our modalities on the counselling course changes dependent on the year. I don't know if that is the same for all counselling psychology doctorates, but it is the same. That's what I have on mine. So in terms of year by year, the first year we focus on person-centered therapy, which I've just completed. And then in our second year, we focus on psychodynamic therapy. And then in the third year, we focus on CBT, cognitive behaviour therapy. So that's how they tend to structure the course. Like I said, that might differ from other doctorates and other courses. Universities might do it differently, but I think that's quite a helpful way to do it, especially having person-centered therapy first, because I didn't really know a lot about person-centered therapy when I started the course, but it's a great grounding approach to counselling and to therapy, and that will obviously transfer through the entire course. So that's how that's split up. And then you've got to achieve a certain amount of clinic or client hours each year. So for first year, you have to achieve 100 client hours, second year 175, and third year 175. So in total, once you've completed the course, you will have 450 face-to-face client hours.
So, okay, that sounds pretty full on. Obviously, you're learning 3 different things all at once. How are you finding it so far? Is it fairly challenging?
Yeah, so it is quite full on. And one thing I remember when we had our induction in one of our very first days was they showed us a picture of a juggler juggling balls, and they said, this will be you for the next 3 years. You'll be juggling a lot. You juggle obviously client work and written assignment work and attending lectures. So there's a lot and then obviously personal life as well. So there is a lot to juggle. But as long as you manage your time, that's really important. And in terms of getting your client hours, I've achieved my 100 client hours already, and you've got until August to do that. So you've got between October to August to achieve those hours. And when you divide it up week on week, that's not a lot of clients each week. So it is manageable, but it is a lot. And then in terms of doing your assignments, again, time management really comes into it.
So you've mentioned it's challenging kind of juggling all the different aspects of the course, but what are there any other particularly challenging elements as well?
Yeah, so in terms of what I'm enjoying about the course is I enjoy that it's quite practical. So it's really training you to practically do your job. And I think with an undergrad, it's very theory based, and you sometimes get a bit stuck with how you can apply that to a practical job. And whereas the doctorate does train you to do therapy and work with clients and work with different presentations and things that might come up in your career. So I really enjoyed that side of things, because you feel like you are progressing as a practitioner and you are making progress. When I look back from where I started, I almost think, oh my God, I didn't really know anything. Whereas now I feel like I've found my feet a little bit, and I'm starting to get more used to the way client work is. In terms of challenges, it's mainly just the workload, I think is quite challenging, which is quite obvious really when you're about to undergo a doctorate. Yeah, it's just the juggling aspect. You've got a lot of different things to do. You've got sometimes you have to put your student hat on, sometimes you have to put your practitioner hat on. So there's a lot to juggle. So I'd say that's probably the most challenging part, but it does get made up in the fact that you're learning on the job.
Yeah, I think the challenging aspect that you're speaking about, like everybody can really relate to that, especially if you're going into a doctorate, like that's what you should be expecting it to be challenging. But one interesting thing that I've heard about counselling psychology courses is that personal therapy sometimes is a requirement of the course. And so like when we're speaking about it being really, really challenging and having to cope with all of these things, I feel like that's a really nice way to supplement. Obviously, all of the work that you're doing is that you also have to have your own therapy. As I said, I'm not sure if this is something that every course requires, but it's just something that I've heard. So it'd be interesting to hear if that's something that is a part of your course. And yeah, just tell us a bit about that.
Yeah, definitely. So that is a requirement for my course at the University of Roehampton. Like you said, I don't know if that's a requirement for every course, but it's something that has been so helpful. And it's been so interesting as well, because I feel like I've learned a lot just by being a client and almost being the other side and what that's really like. But also dealing with the stresses of the course, I've actually found it really helpful to speak to somebody about it every week. So the requirement for my course is that you've got to get 35 hours of personal therapy each year. So that works out to be about one session a week, roughly, between October to August. And yeah, it's been really helpful. I remember when we got told that that was a requirement when we first started, and I kind of thought, I don't know what I'm going to use that for. What am I going to talk about in that hour or 50 minutes? I think it's quite difficult when you are almost forced to go to personal therapy and you sometimes don't know what to expect or what you're going to talk about. But I find something to talk about with my therapist every week, whether that's the stress that I'm going through because I'm writing an assignment, or even like a few weeks ago, I'd had a really positive and productive week, and it was just nice to share that with somebody. So I didn't necessarily have to go to her with problems or something wrong. It was just nice to share that I'd had a really productive and positive week. So yeah, it's really helpful. The only thing I will say is on the counselling course, it's another almost fee that you've got to pay. So you get free reign of choosing your own therapist, but at the same time, you do have to pay that fee for the personal therapy. So that's something that I would advise to take into consideration. Is with the counselling psychology course, there is a lot of outgoings in terms of financially, so definitely take that into consideration when you are looking to apply.
I know you mentioned earlier about you have to get 100 hours of placement per year. How does that work? So do you kind of find the placements yourself, and then how do you kind of organize it with the place that you're working? Do you say I need to like practice this type of therapy specifically? Are they fairly receptive to that kind of thing? Tell us about placements in general.
Yeah, so like I said before, you've got to get 100 hours in your first year, 175 in second and third year. So in total, when you've completed the course, you will have 450 hours, which is a requirement to get HCPC registration, basically. Some other universities might differ in terms of how many hours each year, but that's pretty much the requirement in general. So similar to, I think this is one thing that is great about the Counselling Psychology Doctorate. You have free reign and so much flexibility on choosing your own placement, choosing your own personal therapist, and choosing your own supervisor. So if you currently work at a placement, which was the case for me because I already worked at a private therapy clinic, as long as that was signed off by the university and they said, yeah, that's great, they're going to support you and it kind of ticks all the boxes, then I was able to continue my placement at private therapy clinic. Lots of other people did have some difficulty finding placements, but the university are really helpful at helping people find placements. And there's a massive database as well that has all the placements that are available on there. So if you are struggling to find a placement, the university will be able to help you with that. And yeah, for me, it was just a case of speaking to my placement and just saying, so I'm going to be having to practice person-centered in my first year, and then transitioning to psychodynamic for second and CBT for third. So some people change placements each year, and they do advise that you get at least 2 different placements in your entire course, I guess, just to give you a wide range of experience as well when you finish, which I think is also really great. So it's very, it's your decision where you go. When you change your placement, you can change it every year, or you can stay at the same placement for first and second year and change in third if you wanted to. Again, in terms of the different places, there's such a wide range on my course of places that people are carrying out their placements. So for me, it's obviously private therapy clinics, so private practice. Some of my colleagues are doing their placement in the NHS, and some people are doing them in organisations such as prisons or schools as well. So there's such a free reign and flexibility on that. And I think if you have a particular interest that you'd like to carry your placement out in that place, for example, if you wanted to work with children, or if you wanted to work in prisons, for example, you can tailor that. And I think that's a really great thing that they offer that flexibility.
I just had a question about like on client work. Just I've always thought about how is it like actually assessed? Like, do you have to record some of your sessions, or like I'm guessing no, people don't sit in. So I'm kind of, yeah, how does that work?
Yeah, that's a really good question, and that was a question I had when I started. Yeah, people don't sit in because obviously confidentiality. It differs for different assignments. So for example, one of my assignments, I had to submit an audio recording of a session, and I had to transcribe that and then analyze the session, for example, saying what I could have done better, what I think I did well, how certain things maybe changed the session a little bit. So you do a bit of an analysis on your session. And then for other assignments, you just have to use a client. So you don't necessarily have to submit an audio recording, but you will use client material. So you might use their presentation, and then you might write about their assessment process or a formulation. So you do use your clients with all your work, and some you have to submit audio recordings for, but some you don't. So it's a real mixture, but it's really nice and actually strangely enjoyable to write assignments based on your own practical work, because you've done it and you've lived it and you've actually been there. So to write that down is really interesting. And I actually found it helped me after I'd done an assignment on one of my clients in particular. I found out things that I didn't even realize that I probably wouldn't have realized if I hadn't written the assessment. So yeah, so it's assessed in different ways, but it's a mixture of audio recordings and just using client material. But that's something, going back to placements, that I will say, make sure when you are looking for your placement that they do allow you to audio record. Obviously, you've got to get client permission, but some placements just don't allow audio recordings. And that's been something that some of my colleagues on the course have struggled with. They started a placement and then realised they couldn't audio record. So then they had to change, and that almost wastes a bit of time. So that's definitely something I would note early on, and to check with your placement.
It's nice to know that like the coursework and assignments you're doing actually feel like they're helping you develop like as a therapist. Like you say, when you've like reflected on the experience, it actually helps you progress, as opposed to it just being a random bolt-on thing. Because I feel like sometimes university things can feel a bit disjointed from the actual work you're doing. So that's really great to hear. Well, I guess thank you so much, Jade, for sharing all of your experiences with us. I think it's been such a well-rounded overview of the Counselling Psychology Doctorate, and you've given us like both the good and the bad, which I think is so helpful for people when they're trying to decide, you know, what kind of course they want to go on to and what course is right for them, because obviously there are pros and cons to all of them. So yeah, it's been great that you've been so open with us and like shared so many interesting tips and facts about the course. So thank you very much.
Thanks for having me, guys. And I hope it's helped as well. If there's anyone watching that's weighing up their options or thinking about applying for a counselling psychology doctorate, yeah, there is pros and cons, like you said, to every course, but it's quite nice, I think, to hear those maybe before you do embark on the journey of 3 or 6 years.